JRI was founded by an eminent orthopaedic surgeon, Ronald Furlong, in 1970, and we design, manufacture and distribute orthopaedic implants to treat musculoskeletal problems. JRI were innovators in hydroxyapatite ceramic coating of implants. So that's an artificial bone material that we apply onto implants to help them fix to the patient's bones permanently. We also have some very advanced manufacturing techniques that we use for precision manufacture of orthopaedic implants in a very heavily regulated and tightly quality controlled environment. We also utilise sophisticated bearing technologies to reduce the wear of joint replacements to ensure they're durable and they last the lifetime of the patient. The patients that receive our products are predominantly suffering from osteoarthritis, a degenerative disease of the joint, wear and tear of the joint, so it tends to be older patients. However, also patients who have traumatic injuries, fractures and the like can also be treated using some of our joint replacement products. We also have products that improve mobility and they all remove pain, which is really the primary reason why patients might need joint replacement implants. So joint replacement implants aren't just for elderly people. They could also be for young people too, particularly those that are involved in sporting activity, because perhaps they can wear out their joints a little bit quicker than they'd expected, and also maybe they've been subject to injury or trauma that's damaged the joint. But with a good joint replacement, they can usually return to a very active lifestyle and often back to competitive sport too.
"18 months prior to my operation, I started feeling pain in my hip, and a couple of times my leg gave way. It was a long process to resolve the issue. I had some physiotherapy, tablets, painkillers, so I had an MRI scan. The scan showed that I had a vascular necrosis, which is basically where the blood supply stops, so your femoral head dies. So I was in quite a lot of pain. I was very miserable with the wife, with colleagues at work. Sometimes I'd even be in pain driving. Dipping the clutch was painful. The great thing about my operation was I remember waking up on the operating table and the pain had disappeared immediately. I was up back to work after 8 weeks, and I was doing light karate after 12 weeks. And slowly building myself up. I still feel a little bit of weakness within the hip, but it hasn't stopped me doing anything I want to do. I can go out cycling, I walk the dog, I do karate, circuit training. Cycling's great because you're not impacting your muscles, your legs, your hip joint, your knee joint as you would with jogging. I find it a nice gentle type of exercise, constant pedalling. I'm lucky enough to live the Pennine Trail right outside my doorstep, so I do a nice little circuit when I'm feeling up to it to Dunford Bridge and back, which is a nice 13-mile cycle.
Well, JRI have always manufactured our products in Sheffield and will continue to do so because the Sheffield City region and South Yorkshire are a tremendous hub for medical device manufacturing, medical device design, medical device research. So there's a really well integrated and very well established supply chain. So JRI continue to innovate and to develop new products, new techniques to help surgeons to treat patients more effectively. We collaborate extensively with academic institutions and with our supply chain partners to develop tomorrow's solutions that will ultimately lead to much better outcomes for patients in the future.